month, and so we are ending it with one of my faves. And this is Michele Minasola, and Michele is a pelvic floor therapist, right? So I'm gonna give Michele the floor to introduce herself and kind of where you're from and what you do and how long you've been doing it.
Sure. Good morning and welcome. Happy to be here. Thanks so much, Danica.
Yes.
So I'm originally from the East Coast, and I went to physical therapy school in a small school called Slippery Rock University in Western Pennsylvania. And I've been practicing as a physical therapist for 25 years now.
Oh my gosh. Wow.
Crazy,
Yeah.
yes. And I've been practicing as a pelvic physical therapist for a little over 15 years now.
Oh, okay.
So that's what I've decided to specialize in. So
Nice.
yeah, so
Awesome.
it's been wonderful.
And I'm so glad you're here, so
Thank
you.
you.
So before, guys, we dive into pelvic floor, which a lot of you are probably like, what the heck is that? I do want to highlight our sponsor. And our sponsor is Cliff Young, who is the CEO of Young Life CMOS. And we're going to put his information on the bio on the bottom of the screen in the video so you guys know where to find his products. If you guys don't know what CMOS is, you have to look up all the benefits for it because it's amazing. He has soursop leaves, which you can drink as a tea. So definitely check him out. He's amazing. He's a local business owner here in Tulare, so support the businesses here around town. And okay, so we're gonna get started. And I really want to start off, Michele, with just telling the people how I even started with pelvic floor therapy with you. And I want to highlight and I want to share a little bit of my journey and what I went through because I really feel like it's important that people understand and know that pain is common. It's just not
Definitely.
normal.
Exactly.
And so many of us women experience the same type of pain, right?
Definitely.
And we just don't talk about it. And so that's what I want to do this morning, guys. I want to share kind of how 13 years ago I've been a patient of Michele's. I started in like 2010 or 11. And it started with the inability to be able to have intercourse with my husband. And I didn't know why. First, I couldn't have a pap smear, and I didn't know why. And that led me to, I was at my gynecologist, and for a yearly, and I couldn't get, she couldn't get the speculum.
Yes.
Yeah, the thing that we all do not like.
What everyone dreads,
Yes.
that annual exam.
Right, an annual exam. It was unsuccessful, and I had no idea why. I didn't know anything that my condition, I didn't even know it existed. And so my gynecologist, she's amazing, guys, in Visalia, she told me that I could have this issue called vaginismus and that she was going to refer me to a pelvic floor therapist. And so I'm like, this is all foreign information to me. I have no idea what that was. And so she referred me to Michele, and we got our first appointment down, and she's such a pro that she had like tissue already there because she knew this was going to be a very emotional ride for me and a lot of other patients that she has. So the room was, I'm telling you guys, the room was like set, and that was like the most, I don't know, looking back, I'm like, wow, this is really your calling, first of all. I know you said you did physical therapy first,
Definitely.
and now you're in pelvic floor because
Yes.
this is literally what God has called you to do. Because what I'm telling you, I walked into her room, I mean, it was like, I got the most, like, a sense of just comfort being in her chair, and she just talked to me, made me feel comfortable, made me feel like I wasn't alone. Like I wasn't an alien, like these things that were happening to me that I had no idea. what they were, she didn't make me feel like I wasn't normal. And so I talked to her about my issues that I was having, and about my recent visit with my gynecologist. And she said, okay, well, this is how it's going to happen. This is what that means. This is what this is. And we went from there, and we started with simple things. Like, she told me that I was in control of my appointment and the treatment that she was gonna show me and work on me with. I would tell her if I was in any pain, she would stop, just things like that. And it made me feel really comfortable being a patient of hers. So vaginismus, I'm going to back up a little bit. It's involuntary, and I'm going to let her go through that as well. But it's an involuntary spasm that happens in the vagina area. And so it's impossible to get like tampons in, or it's impossible to do the pelvic floor, the pap smear exam, the annual exam. It's impossible for anything to pass through those muscles. So there's spasms that happen. And so she's like full hands-on with this type of treatment that she does. And this is just one part of her treatment. She's hands-on and just really trying to get those muscles to be welcoming to any type of penetration, and welcoming to whatever needs to happen, whether it be you're trying to insert a tampon, or you're trying to have intercourse, or you're trying to just get an annual. Just really retraining those muscles. And so that's basically how the treatment starts. And so I immediately felt super comfortable with allowing her to examine me and to learn how severe my condition was. And so I do want to start with you explaining the vaginismus, how it can why it happens, and treatment for that
Sure.
type of, or maybe you can open up actually with pelvic floor and just the different types, and then we can start with vaginismus.
Okay, yeah, sure, no problem. So pelvic floor therapy, or pelvic health therapy, is a special type of therapy, kind of a niche practice within physical therapy, that encompasses bladder issues, bowel issues, pelvic pain, sexual issues, pregnancy, and postpartum. Mm-hmm. So we, offer a wide variety of services in terms of pelvic health. And there's always that orthopedic component to mm-hmm. pelvic health, which is kind of how I started my career. Mm-hmm. But then as a pelvic health physical therapist, you have to have an understanding of the reproductive system, of mm-hmm. the urinary system, of the GI system, mm-hmm. Of the nervous system, the lymphatic. So it kind of encompasses all of that. So you're treating the whole person and trying to identify, what the root of their problem is, so mm-hmm. that you can best help them. So. Yeah. And, as a pelvic PT, our role is to provide a safe and comfortable environment to that patient, because mm-hmm. quite often, as you've experienced yourself, that very first appointment, you're nervous, you're mm-hmm. anxious, you're not really sure what to expect right. at that initial appointment. And so we really just try to just create, just that comfort, that level of comfort, right. So that you feel comfortable with expressing yourself freely about what you're dealing with, mm-hmm. because it impacts your quality of life. Right. Things that you probably never thought about before, like, sneezing and leaking, right. And right. thinking that, oh, this is normal, I just had a baby, mm-hmm. and, oh, my mom deals with right. this or whatever. Right. Like, this is just something, as a woman, I mm-hmm. have to deal with.
And I've heard that so many times just in conversation with friends or family of women that had kids. They're like, oh, well, my grandma had 13 children. There's no way that she was just sneezing and peeing on herself every time after every kid, and she probably was, grandma probably had the same issues, but didn't know that there was help out there.
Definitely.
So it does affect, like you said, quality of life.
Right. Yeah. Mm-hmm. So.
Yeah. And so with the all of the different types of pelvic health situations that are the situations that women go through with the vaginismus. Can you just talk a little bit about those treatment plans or what that entails,
right,
and what it is?
Okay. So oftentimes with vaginismus, there is a component of some kind of, trauma, whether it's sexual trauma, physical trauma. There can be kind of that emotional, kind of that emotional kind of component to vaginismus that causes that involuntary activation or contraction, that tensing of those pelvic floor muscles, which doesn't allow, anything to penetrate the vagina region. So when working with someone, and kind of reviewing their history, and, asking them specific questions about, whether this condition is something that's primary, meaning that they've never been able to tolerate any type of penetration vaginally, or whether it may be a secondary or an acquired type of condition where once upon a time they were able to tolerate vaginal penetration,
right,
and then some kind of event afterwards, then they were unable to tolerate penetration. So,
have you seen in your years of being a PT with pelvic floor a patient that may, like you said, it can be like a secondary, maybe after having like vaginal birth, vaginally, like is it a possibility that vaginismus can like creep up after that, maybe?
Sometimes,
yeah.
or sometimes after surgery or something, and everything could have just gone perfectly, but
right,
whatever the response in those tissues
right,
were causes that overactivity and that just kind of involuntary contraction. And
right,
it's like, so oftentimes when we're working with someone, we're working on, trying to figure out what's the brain trying to protect, and so a lot of the treatment that we do is helping to quiet or calm the nervous system down and trying to change input to the brain so we can kind of change the brain's perception of the pain and give a woman tools that they can work on at home and with their partner to help them to be able to successfully have vaginal penetration, without pain.
Right. And it is very psychological. That is, and like I said, you really have to have a calling for this because as a patient, when you go in, we're freaked out. We feel broken most of the time, and it's like you said, it affects the quality of life. And when you guys work on the psychological part, it's really a gift because the nerve, like you said, trying to calm the nervous system and connect the brain to the pelvic floor. I mean, we've had some really deep conversations during treatment where I'm like, wow, I never knew that. Even till this day, it's like I just learned something new about my body. And so when I go and have conversations with women, I'm like telling them exactly, making it plain and simple, like this is kind of like what it is. And it's not even really all surrounded by vaginismus. It's just different things, which kind of leads me, I know a big one is prolapse. And can you touch a little bit on that and tell us what that is and what are those symptoms? What does it feel like?
Sure. So prolapse is really like when you lose support of your pelvic organs. So your pelvic organs consist of your bladder, your uterus, your rectum. And so that loss of support, maybe the pelvic floor muscles are too weak, or like the connective tissue, the ligaments are like overly stretched. And so instead of those pelvic organs being kind of centered in the middle of your pelvis between your pubic bone in the front and your sacrum in the back, they've dropped a little bit, so like your bladder or your uterus may have dropped down a little bit more, and your rectum may be pushed forward kind of in the back vaginal wall. So there's different types of prolapse. So a cystocele would mean that your bladder has basically dropped, or is not in its normal position. A rectal seal would be for the rectum. A urethra seal would be the urethra. And then you also have like the uterine prolapse would be the uterus. And they even have an endoceal, which would be like your small intestines or kind of a little bit lower there in the pelvis. So.
And why does that happen? Like, what are some like lifestyle changes and what changes in life that happens that leads to prolapse?
So prolapse, obesity is a major factor that can contribute to prolapse. If someone has like a chronic cough or, you know, some kind of chronic respiratory issue, and I mean living in the valley here with our lovely air, so that chronic coughing, we're constantly like increasing the pressure within our abdominal cavity, and that's putting more pressure on our pelvic organs. Even like chronic constipation, so, you know, not having a regular bowel movement, straining to, you know, evacuate your stool, that can over time lend itself to pelvic organ prolapse. Childbirth, particularly vaginal deliveries, and then the more kiddos that you have, that can contribute. Surgeries, like having a hysterectomy, you know, you're removing, you know, the uterus, which is centered between the bladder and the bowel. So there's this space that's there, so then your organs can kind of shift and change. Menopause, even when we experience hormonal changes in our body, and even like if we have some type of connective tissue disorder, where we just don't have quite that support in our connective tissues. So those are all factors that may contribute to prolapse.
Right. Wow. I knew about like maybe hysterectomy, but I didn't know something as simple as like chronic coughing and if you don't really know how to control or support your abdomen area, then I can assume that like that can play a huge role if you don't know, like, is there a certain way to cough where you can control, you know, where you can help support that?
So, I mean, you could just simply just kind of see, like, how do you cough? You know, if you just place your hand on your abdomen and you cough, like, what happens? Does your abdomen kind of go in and up, or does your abdomen push down and out? So if your abdomen's pushing down and out, then that's contributing to that pelvic pressure.
So you have a prolapse patient and you teach them those things, like if like during your observation, are you like, well, how do you cough? Like if, for instance, as an example, and you teach them how to, because I know I'm a patient of yours, so I know how detailed you get in that room where you're like, let me see how you stand, let me see how you know how you sit, let me feel like your hip area or whatever it is. So with the cough, I'm kind of stuck on the coughing thing. You do something as simple as like put your hand on your belly and let's see.
I'll just observe what happens, you know. So you're just kind of just observing what naturally happens, and it's just gathering information, kind of giving you information of maybe what you may need to address, you know, with the treatment.
And so when that patient goes home, I'm telling you guys, like, you'll have your hand on your stomach all day. It's like, okay, how do I do? Now you're in tune with your body, and that's the only thing you can think about is, am I coughing right? Like, it really is that like extensive, but it's good because now we're aware of these things that we may not have known can contribute to the pain that we're having. I mean, something as simple as walking or coughing or sneezing, you know, and these things are not told to us during other appointments with, you know, other appointments that are just, you know, doctors that specialize in what they specialize in, you know, maybe gyno or just your regular MD. So that's why it's huge. It's very important to talk to your doctor about these types of issues and things that you're having so that they can refer you out to a PT, a pelvic PT, if that's what you need. But always be vocal with your doctor.
Yeah, and I think just even knowing what the symptoms of prolapse are, so that, you know, if you're experiencing these symptoms, then you can have a conversation with your gynecologist, you know, your OB, with your family health care provider. And so, like, if if you're feeling any pressure or heaviness in the pelvic region, if you're feeling a bulge vaginally, like say you go to wipe and you kind of feel something, or maybe you have a mirror and you're just kind of checking, and you notice just some tissue kind of close to that vaginal opening or at the vaginal opening. Even if you're having some difficulty like emptying your bladder, or sometimes you may have pain in your lower back or your pelvic area, or maybe you feel the need whenever you're having a bowel movement to kind of press up on that perineal area, so the space between your vaginal and anal openings. I mean, those all might be signs of, having a prolapse, or maybe when you're sitting, you feel like you're sitting on a golf ball, or you're experiencing pain with sex.
Wow, yeah. And so what does the treatment look like for that, for prolapse?
So basically we would take a look at, someone's posture, their alignment, and kind of watch how they move through their spine and their hips, observe, what happens whenever they cough. And then we check in with their pelvis, and we just kind of check in for the springiness of the pelvis, just because we have a ton of muscles that attach to the pelvis. We have your abdominals, back muscles, hip muscles, besides those pelvic floor muscles that are housed on the inside. And then, we'll look in through the abdominal wall and kind of assess like if there's any stiffness or restrictions within that abdominal region, and kind of what someone's core strategy is, and before we would even do a pelvic floor muscle exam. So, and when we do a pelvic floor muscle exam, we are assessing basically, what's the tone of those pelvic floor muscles? Because at rest, those pelvic floor muscles should kind of feel like jelly, and if we find that, it feels a little bit more like peanut butter, then we know there's a little bit more activity in those pelvic floor muscles than what we should see, at rest. Or if it feels really hard or firm, kind of more like a bone or a rock or, cement, that type of thing, then we know there's a lot of overactivity in those pelvic floor muscles.
Wow.
So just kind of identifying kind of just the normal state of the pelvic floor muscles. And then we can ask you to contract those pelvic floor muscles. Can you relax them? Can you lengthen them? Is there a reflexive response in those muscles? So it can have you cough and kind of see if we find that those muscles reflexively respond or not,
Right.
And then we can check in terms of just the staging of the prolapse. And so just kind of the positioning of where the bladder or the uterus or the rectum may be, just to, again, gathering information. Right. So. And then when we dive into the treatment, we take that whole body approach, because sometimes it is someone's posture and how they're positioned that may be creating more pressure in that pelvic region, or sometimes it's maybe some of the strategies of how we move, maybe if we're repeatedly bending over, picking up toys or something from the floor, and if maybe we're hunching or rounding too much kind of in our mid or upper back area, that may be contributing to putting too much pressure, on our pelvic region. So that might be something that we have to address. So like how we're positioned, how we move, how we empty our bladder and bowel. If we're straining or pushing to empty our bladder or empty our bowel, again, that can be contributing to, the prolapse. So just talking about, what are some good toileting strategies? Squatty potties are amazing. If you don't have one, go get one.
I don't even know what that is.
I think it was on Shark Tank like a long time ago. And really? I mean, it's really a great invention. And I mean, you can get it almost anywhere. You can get it at Bed Bath & Beyond, Lowe's or Home Depot. You can get it on Amazon. And it's just really a little stool, and it's, I guess, like kind of like a half circle shape so that it can hug up against the toilet when not in use. Okay. And but it just you put your feet on this stool so that your knees are higher than your hips. Okay. And that, from a bowel standpoint, helps to open up the angle between the anal canal. And so it just makes it easier for stool to come out. But it's also positioned because it's kind of like a deep squat position. So it helps helps your pelvic floor muscles relax.
Okay.
So then it makes it easier to be able to empty your bladder and your bowel, because that's naturally what should happen whenever you empty your bladder or bowel.
I did read that somewhere where a lot of us are using the bathroom incorrectly.
If you're hovering
Yeah.
the toilet,
If you're like squatting over, like our knees have to be positioned in a way to where our the back part of our colon or something is like kind of aligned.
right, where your sacrum
Yeah.
is more upright.
Yes. So Squatty Potty, send her a check, because she just gave you some free ad right there. Urinary incontinence, is that what it's
Incontinence.
called? Incontinence.
Yes,
Okay, I'm like,
yes.
okay. I'm glad she's here. But can we talk leaky bladder?
Yeah,
Is that what that
sure,
is? Okay.
yeah.
So
Urinary incontinence would be just kind of, that loss of urine, with, sometimes it's with coughing or sneezing or laughing or yelling. So that would be more stress incontinence. Or it could be more of urge incontinence. So you get that strong sensation, that strong urge that you need to urinate, and then you're like rushing to the toilet, and you're leaking on the way. So that is considered urge incontinence. And sometimes people can have a mixture of the two. Those are the most common types of urinary incontinence.
Okay.
So,
I know I have a lot of friends that experience this after having children.
it can be common. Sometimes it's present during pregnancy, and if it's not addressed, it's more common for you to experience it in that postpartum period.
Okay.
So, yes.
Okay. And treatment, what does that look like for?
Yeah. So it's, again, trying to figure out like what may be contributing to why someone's leaking. So we kind of go through similar with prolapse, kind of looking, at alignment and how someone's moving. Testing strength too, not just of your pelvic floor, but also kind of looking at your hips and your gluteals and your abdominals.
Right.
And so it depends, is it that the pelvic floor muscles are too weak and that they need to be strengthened, or that they need to learn how to work together with their other teammates? Because your pelvic floor is 25% of your core.
Wow.
So that works together with your diaphragm, which is your largest breathing muscle, with your deep abdominals, like the transverse abdominis, and your deep back muscles, your multifidi. So they have to work together in a team. And sometimes they don't work in a coordinated effort, and so that may be contributing to why someone's leaking. Or sometimes maybe those pelvic floor muscles are too tight.
Right.
And so you need to learn how to relax or to release the tension in those muscles so that you can contract and work on that strengthening piece. So.
Wow. Which leads me to postpartum and how I know that it's vital for women who are probably currently pregnant, as well as after they've given birth, to at least just see a pelvic floor therapist, just to get things back into a new normal, or find a new normal, after delivering an entire human. So can you just talk about the postpartum and how you can help women in postpartum?
Sure. And I'm going to, if you don't mind, back it up just a little bit, and
please.
just, and put a plug in for pregnancy, because, although, again, very common to, experience some back pain or some hip pain, what have you, during pregnancy, again, if it's impacting your quality of life, it's common, but it's not normal.
Right.
So have a conversation with your OB, and ask if you can see a pelvic floor therapist, so that we can, work on helping to support a woman during her pregnancy, that can help in her managing her pain, and also may help with having like an easier delivery process too. So. And so I think that it's important for us to kind of support women during that pregnancy, and of course postpartum. I feel like it should be standard of care, that every postpartum woman should see a pelvic floor therapist, after having a baby, regardless of whether you've had a vaginal delivery or a cesarean. So, but definitely something that if a woman is experiencing any kind of pain, I've seen women as early as like 1 week postpartum. Wow. But, you don't necessarily have to wait that 6 or 8 weeks.
Right.
Oftentimes we'll see someone, 3 weeks postpartum. And because we can address a lot of just posture, there's a lot of repetitive movements when caring for an infant. You're changing how many diapers a day, you're feeding that baby nonstop, whether you're breastfeeding or you're bottle feeding.
And we don't even realize our bodies are trying to heal in itself.
Right.
While we're trying to care for our little tiny human.
Exactly.
And to the point to where we can ignore those pains, like, we tend to put ourselves last in that moment, because the thing is that we are so focused on our child and our newborn, and that's the most important thing to us at that moment. But I'm telling you, ladies, like, it's really important for you to put yourself first in that moment, so that you can be able to take care of your baby, and you don't have to be in pain doing it. So if you're able to, during those postpartums, like she said, you don't have to wait the 6 to 8 weeks. She's seen someone that was 1 week into postpartum. So definitely talk to your OB or gyno about it. If you're pregnant or in postpartum right now, to get some treatment. And what does that treatment really look like when you're dealing? Does it depend? I mean, what if they don't know? If they don't really know if they have any issues, they're like, they think it's normal, whatever they're going through. They're not in any pain. Is there just like a maintenance, if you will, for a postpartum treatment?
So I have some women that, I've treated in the past, pregnancy, postpartum, or for various things, and they just want to be very proactive.
Right.
And so maybe they're not experiencing any pain. Maybe they feel like their core muscles are a little bit weak or what have you, and they want to come in and just to see, like, is there anything I need to address? Sometimes with a vaginal delivery, we'll notice that the pelvis itself gets stuck in kind of a common birth pattern, and so although they may not be experiencing any pain or incontinence issues or prolapse issues at that time, sometimes, if possibly, left untreated, it may be a contributing factor to those issues. And so we just kind of check in with a woman's body, just basically screening, the musculoskeletal system and seeing, like, okay, what's going on? What's your posture like? How are you moving? Like, what tissues may be restricted? Are your muscles working together? Have they automatically come on board, those core muscles? Or do we have some muscles that are, overpowering other muscles, and we need to kind of restore that balance? So, sometimes, you may only see someone for a few visits, just to kind of check in with them, also give them guidance on, what exercises may be appropriate for them, at that particular, stage, wherever they are postpartum. And so helping to kind of give them guidance on that.
So you don't have to wait until you're in pain, basically.
Exactly. That shouldn't necessarily be a reason, the only reason why you go see a physical therapist.
Right. Yeah, that's kind of like where, over the past years, where I've wanted to keep my appointments with you. I like to call it like an oil change, a maintenance change, where I just go and see you just to make sure things are running smooth, and just to get that maintenance going, and be proactive on it. So can you talk to us a little bit about, because it's not just like a hands-on observation. I mean, you're really in treatment with us, and you also include a little bit of like Pilates in your treatments, right? Which is fun, guys. If you don't do Pilates, you need to. There's some machine work, right, involved?
Yes, we have Pilates equipment.
Equipment that, I mean, when you leave treatment, you'll be so flexible. Like, you'll just feel nice and open. Whatever pain you're experiencing, is like, it takes work at home though too. Like, I do want to touch on that. It's
Definitely.
not just with you, right? Can you talk about that a little?
Yeah. So basically, treatment would entail, manual therapy if needed, and it is oftentimes a large component of therapy. But we also spend a great deal of time of educating,
right?
So educating you about your body, about your condition, about different ways that you can kind of work on helping yourself. So that kind of self-care piece and just maybe what that home exercise program looks like. And then there's the exercise component, which we are heavily Pilates based. And so whether it's using Pilates equipment or just more mat-based exercises, also sprinkling in some yoga. So a lot of mind-body type exercises and working on strengthening, so because I'll have, women that do CrossFit and so forth, and they may have just specific things. And so, we really tailor it to what that woman's individual needs are. But I would say that's probably the main areas of what we focus on is manual therapy, exercise, and education. And so education in terms of the home exercise program is key, because typically we're seeing our patients like one time a week, you know, so that's an hour of how many hours during that week. And so what you do at home matters, you know, and so it may be little things of just working on just some slow, soft breathing, you know, to kind of help in quieting and calming the nervous system down. And maybe it's something that a woman needs multiple times, you know, just maybe just checking in and bringing that awareness, you know, for 30 seconds to a minute several times throughout the day. Maybe it's just doing it once or twice a day, you know, so again, it just depends upon the person. Or working on some different, you know, release positions or some stretches, or working on, you know, mobility exercises like cat-cow or something like that. Or working on strengthening exercises, you know, maybe a lot of the times the exercises look very similar if you were coming to therapy for back pain or hip pain, you know, so, you know, it may include like bridging and clamshells and, you know, bird dogs and, you know, those types of things. So oftentimes, again, the exercises, no one knows, like, are you doing pelvic therapy or are you doing therapy for your back or your hips? So, but yeah, definitely that strengthening piece and working on behavioral changes too, you know, so if maybe your toileting strategy, you know, is not the best, you know, maybe you're pushing or straining, is just working on kind of correcting that, or maybe, you know, you're going to the bathroom like, you know, every time before you leave the house, or, you know, before you exercise or something like that. Or you know, it's just working on some strategies and maybe implementing like a time voiding where you go like, I'm going to go every hour, and then you work on increasing that interval to maybe every hour and a half to every 2 hours, you know, so that you're going within kind of that normal window of voiding. So
definitely mind body, what pelvic floor in particular PTs offer. Like it's a part of self-care for sure, because I remember many times I've left, and if I wasn't leaving crying, I left feeling very just like empowered and strong, and feeling like I'm not alone, number one, and number two, there's hope, and I know that I can get better physically. And even just with the Pilates, I mean, when you introduced that to me 13 years ago, it's like, it felt really good. Like, it just felt good to strengthen those different types. I mean, it really is just a mind thing. It's mind and connecting your mind with your body.
Definitely.
And you even taught me how to do things like just put your hand where the pain is and breathe. And you've taught me different breathing techniques on how to just breathe and where to breathe from, and, you know, how to breathe. And we don't think about those things and how important. It's like, I just breathe. I don't know, you know, we're just breathing. But there's a way that you can breathe where it'll benefit you and whatever pain you're going through. So, so important. Is there anything else that you can, that I may have missed? I mean, I know there's a wide range, but for the most part.
I know, it's hard to fit everything
It
in
really
just a
is.
short period of time. So we also, as pelvic PTs, treat bowel issues, so like constipation or fecal incontinence, which would be the loss of stool. We work with women that have diastasis recti, so just kind of that abdominal separation. Even like post-surgical, so if someone's had any kind of abdominal or pelvic surgeries, then that may be a reason that we'll see someone in the clinic. So,
And do you treat men?
we do treat men.
Oh.
So oftentimes we'll see men for pelvic pain as well, because they can have those spasms or increased tension in those pelvic floor muscles as well. Sometimes they may have been diagnosed with like chronic prostatitis. But yes, men can have pelvic pain too. And probably the other most common reason we see men is for post-prostatectomy. So when they remove that prostate, there's a huge loss of support to the urethra. So oftentimes men will have some incontinence issues after that procedure. So,
Interesting. Oh my goodness. I know I can sit here and talk all morning. Can you just touch a little bit on vaginal laxity and what that means? I mean, and how that can creep up on you as a woman too.
So oftentimes in terms of vaginal laxity, that may be a component of prolapse that we had talked about earlier. So that kind of lack of support. If you think of it as, I'll give you an analogy. You have like a ship, that's docked, okay? And the water underneath the ship is those pelvic floor muscles, and the ropes would be like your ligaments or your connective tissue, okay? And let's say that the water, has gone down and it's kind of dry docked, so you don't have that support of the muscles. Now that boat is being supported by those ropes, okay? And they may only be able to hold on for so long before that boat, which would be like your pelvic organs if we're talking about prolapse, kind of drops. So when you get that amount of laxity, that happens in the tissues, oftentimes that's something that requires surgical intervention. Okay. Now, if there's just a little bit, of just kind of stretching, if you will, okay? So a little bit of laxity in those tissues. Often you can work on strengthening those muscles around the area that might provide support, better support to that area. So sometimes maybe even, after having a vaginal delivery, I mean, those muscles and those tissues, have to stretch to accommodate baby. Sometimes you can work on improving that with the strengthening, but sometimes they're just overly stretched, and it, you can't get it back with no matter how much physical therapy you do.
And at that point,
surgery would be required.
Gotcha. So thinking about, I have a lot of like older aunts and people that are in menopause or experiencing different types of issues, and so you see women of all different ages. And
we'll see women of teens into like, I've even had a woman in her like early hundreds.
Oh my goodness. Wow.
So we treat women of all ages.
And all different issues.
Sometimes it may be painful periods, sometimes it may be endometriosis, sometimes as someone is going through menopause, maybe they start to notice some, urinary incontinence, or maybe they're starting to experience some prolapse symptoms or what have you. So anytime we have those huge shifts in our hormones as women, we're more susceptible to, develop, or having, pelvic floor issues at those times. So.
I hear a lot about dryness. Is that something that you treat or?
So it's something that is often a common symptom or complaint of the women that we see, and it can be related sometimes hormonally. So after a woman has a baby, her estrogen levels, drop. So it's kind of very similar to like that perimenopausal, menopausal
Right.
time, whenever, we have that estrogen reduction. And so that can be a common reason for that vaginal dryness. So in those cases, then we would recommend using a lubricant with sexual activity. That can be super helpful, so there's not that friction
Right.
during sex, which can be very uncomfortable or painful. And sometimes the OB or GYN may also prescribe like an estrogen cream or something to help with that. But oftentimes, or other times that you may see vaginal dryness is if there's too much tension in those pelvic floor muscles, and then that doesn't allow the glands to release their secretions and help with the lubrication vaginally.
Right.
So you'll oftentimes notice that as those pelvic floor muscles are being released, that you're going to have better blood flow and also better lubrication too. So.
Wow. I just get like so intrigued, guys, with all of this, because who knew? Like, there's just so many components to just pelvic floor in our bodies. And it's definitely, like I said earlier, a form of self-care to just get in tune with our bodies and talk to your gyno, your OB, your gyno about referring you out to a pelvic floor if you're a woman and you're pregnant or you're postpartum, or you're in a stage of life where hormones are changing and you're experiencing different types of issues or not, and you just want to be proactive in getting pelvic floor therapy. So this was great, Michele. Thank you so much. Michele is, if you guys want to reach out, or you want to, if you're in the area, Central Valley, you can message us on What's the Biz if you want some information on where you can see Michele, but talk to your OB, your GYN to get referred out. You don't have to go to the pelvic floor therapist that your OB is referring you to, but just weigh your options out, do your own research, and see where you can get seen at. But definitely, this was great. I had a really good time, and thank you for seeing me and fixing me through all these years. I have learned so much about my body, and my goal was just to get other women on board, because I know that a lot of us suffer in silence and we don't have to. And I think that's the main thing. A lot of older women, this wasn't offered to them growing up, when they were younger and had children. It wasn't offered to them. And so the most important thing was just to let them know that there's help and that they're not alone, and they don't have to suffer.
Exactly.
So you guys are doing an amazing job there, and we're so thankful for you.
Well, thank you. Thank you for educating women.
Yes,
and
absolutely.
So that's our goal, is to empower and educate women. Knowledge is power. And
absolutely.
So, when we're working with our patients, it's like we try to encourage them, when they feel comfortable to share their experiences, with their sisters or their moms or their daughters or their friends and so forth, so that they aren't suffering in silence, and maybe their loved one is also suffering in silence and don't realize, like, oh, okay, I have this support system here. I'm not the only one dealing with this issue. So.
Yes, it can really drive you crazy if you hold it all in. It really can. It's taken me a long time to come out with like posting these things on social media. I started maybe like a year ago or 2 years ago, just posting about it, sharing different things. I follow a lot of PTs on Insta. But during conversations, I've talked about it since I've been going through it. And because I'm like, I can't be the only one in this world. Actually, I had watched a show that was called, I think it was called Strange Sex, and there was a couple that was experiencing, a woman that was experiencing the same age as I was back then, the same exact issue, and her story was like, it mimicked my story, and it was the craziest thing to me, and I'm like, Oh my gosh, like that was actually really what how it led to the conversation with my gynecologist. I told her about the show I had seen, and I'm like, this girl experiences the same thing that I'm experiencing, so I know that there's something out there that can help me. I don't know what it is, and that's how that conversation got started. But yeah, it's the most important thing was that I'm so happy there was a treatment plan for me. So, and there's a treatment plan for a lot of the women out there. So, we're gonna wrap it up, guys. Thanks for tuning in. Share, talk about pelvic floor therapy with your family. There's help. Don't suffer. I hope you guys all have a really good weekend, or week. I'm sorry, week. The weekend went by too fast. We need 2 more days. But anyways, you guys have a great day. God bless you all, and peace out.